Welcome back, guys, to another episode of Hormones Happen. I've got a real treat for you today. I have a special guest. Now, this isn't just anyone. This is someone who is a very driven nurse practitioner, and he's understood that insurance sucks. And so he's actually started what's called a DPC clinic. And we're going to talk about what this is, how this works, and we're going to talk about his thoughts on DPC practices. I also have to mention he's one of my best friends too. Kris, thanks for being with us.
Jeremiah, dude, thank you so much for inviting me. It is a real pleasure. Thank you, man.
Sure. Absolutely, brother. Absolutely. So just so everyone kind of gets to know you, just give us a quick 60-second story of, how long you've been a nurse practitioner, what you've been doing, and what drove you to want to do a DPC practice.
So yeah, I've been an NP since 2020 before COVID. I spent most of my career in working in corrections. I also do emergency medicine 1 day a week at a local ER. And, really, I've heard of DPC. I mean, you and I have talked about this before. I think you even decided to do your own thing. We talked about different models, and I was like, that just sounds kind of. I'd say it's like a good idea, but like where I live, is that really an optimal a solution to healthcare? And then I would have so many people, so many friends, whoever would ask me to help them out, treat them, and I was doing that for free. But then I thought, why do it for free when I can make some money off of it? So we did some research on DPC. I'm definitely talking through you, and I decided to give it a whirl. And you'd be surprised how many people actually have loved it, because I get a lot of patients where they go to a regular doctor, and because they don't have insurance, they're paying $150, $200 for a visit. That does not include labs. And so it made me feel better to know that there is a need out there. It's just not talked about.
Sure, absolutely. The need's always been there, even if we weren't really acutely aware of it. Now, just for some people that may not be aware of it, what is a DPC practice exactly?
So direct primary care, essentially, it eliminates the need for insurance, and it's a cash based model. Just speaking from my practice, there's many different practices out there. I offer two ways of payment. So one is a subscription based, and everything's on my website. It's all broken down by age. But with a subscription, you get like 2 visits a month. You get some labs, and then there's also I call like the urgent care need, where you just need to be seen for one visit, and that is about $65 visit. And so really, again, the goal is to eliminate insurance. Now, I am finding that some insurance is paying for my prescriptions, but even using my wife as an example, we got her an X-ray of her foot, and with insurance, it was going to cost us out of pocket 200. Not using insurance, $52 or something like that. So I mean, that just tells you the markup of using insurance.
Crazy.
Yes, yeah. So
Damn.
and really, with me, as long as I'm up and I'm free, like I'm answering texts, I'm answering phone calls, I'm helping people. Like I don't have a set time really. So I guess in a way that's almost like concierge, I would say, where I don't have set office hours. As long as I'm available, I'm helping someone out.
Absolutely. And you bring up a great point. Like, what separates insurance based from DPC? Everything you said, I agree with 1,000%. I think what you also said was the concierge abilities, right? We don't have to spend just 15 quick minutes to get in and out. We're not boom, 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 boom. Right? That's just That's just protocol medicine, and it's horrible. We actually get to spend time with people. We're
Right.
actually answering texts, phone calls, right? We're there with you on this journey of health. Whereas when you're relying on the insurance, believe it or not, guys, your providers don't have control of your health. Insurance does. The provider will try all they can, but guess what? If insurance doesn't want you to be treated in a specific way, you're not going to get it. So DPC is closing that gap to where we're able to actually allow people to have a say in their health and be in the driver's seat of the bus while we're in the passenger seat, just kind of like giving them directions, right?
Right. Yeah, absolutely. And most of, I think, the headache comes from our colleagues, where people on the outside don't understand this, where our colleagues in primary care are being forced to increase their productivity, right? So more patients you see, the more money the clinic makes, not necessarily the provider, the clinic or the hospital or whatever works for. So in reality, it's like you're going to address one issue and that's it. If you want to address the second issue, you need to make another appointment. And so really, I've been able to address, depending on their issues, multiple issues at once. Now, right now, most of the patients I see are pretty simple. I would say, they're like one or two chronic care issues. Right now, it's flu season, so I'm seeing a lot of URI symptoms. But that's really the joy of it, where I can take as much time as I want. So far, I'm getting a lot of positive reception from it.
I love it, dude. I love it. I bet you are. I bet you are. And the thing is, we're able to tailor this to a specific individual, right? If someone has more than one issue, we're able to address it right then and there. But that also brings up a great question. Who's a good candidate for DPC model? Because there are some instances where insurance is very, very valuable. So what are your thoughts? Like if you were to say who's the perfect candidate for this type of model where they pay a monthly fee, we're there for them if they need anything, who would you how would you describe that patient?
I would say someone that's relatively, I would say actually, Frank, probably anybody, honestly, anybody. There are some people that do have a tons of chronic care issues. They do have a lot of specialty referrals they need. I don't know if right now I'm the best person for that, and I want to let them know that, hey, you got a lot going on. You need a lot of specialty consults, and I just don't have right now the ability to get those all set up. But for the most part, patients that are rather stable, they don't have a lot going on, they just want yearly blood work or they just want to be seen every 3 months, those are the perfect patients. And also with my practice, it's all virtual. So it's wherever you're at. I send you the link on Spruce. We use your we can use your phone. I've used phone calls.
Beautiful. Yeah.
I've even seen patients like, hey, like people I know, hey, at Walmart, literally, hey,
There you go.
we talk about this real quick. Like seriously, I mean, I'll send you
Yeah.
the link. We'll talk more about it privately. But I've had a few patients hit me up at Walmart,
Oh, I bet.
and
Yeah.
especially where we live out in Arkansas Valley, out in eastern Colorado, there's such a disparity of providers. It's taking people 3 months to get in. There's no continuity of care, especially with like the bigger healthcare practices in the area. So far, like I'm doing really well. I'm still able to manage my patients and still able to manage the other jobs I have going.
I love that. You're one of the busiest guys I know. This guy's got like 2, 3 jobs. But the thing is a lot of people probably have this misconception that, and first of all, going back, I agree with you 100%. If someone's, morbidly ill, they've got multiple comorbidities, they're requiring multiple specialty referrals, imaging, medications, sure, that patient might be better to stay within the insurance realm just because of gross cost. But for the most part, just about anyone could benefit from a DPC model because we retrain you as well how to actually take care of your health. And when you take a proactive approach to health, you don't need all that bullshit on the reactive end, right?
No, you don't. You don't.
Yeah,
That is that is true. And so really, I think you and I can relate to patients where we've had patients when you and I worked together that took care of themselves. You could look, we could go back and see, hey, yeah, this person's definitely taking care of themselves versus those that aren't. And so, really, a lot of people just like convenience as well.
sure. Hell yeah.
That is, who wants to go in a waiting room? I don't. Who wants to go sit in a waiting room when I can discuss with you and treat you over the phone or say, hey, maybe I can't. Maybe you do need to go to the hospital. Maybe you
Hmm.
do need to go. So, you know, right then and there too, you're helping patients. You might as well jump on the bandwagon.
Get on it, dude.
That's literally the way we
Or
just
watch
love
the train go by. Yeah,
yeah,
that's
we
it,
love
dude.
convenience. I mean, think about Amazon. We have Instacart. We have DoorDash,
DoorDash,
right?
Grubhub.
They do not like to leave our house. And man, I was very apprehensive I was so apprehensive. But my wife kept saying, "Hey, you should really try this. I think you should do this." And so
Yep. I
you
remember,
absolutely
dude.
you
I
helped me so
remember,
much,
bro.
right? You helped me go through the EHR process because you had done your research.
Oh,
I,
dude,
I was
yep,
doing my
yep.
research,
Oh
and
yeah,
we spent
dude.
days at work talking about this.
Crazy shit, crazy shit. But tell me this: is this true or false? You have to be rich to be part of a DPC.
False. False. Now, my prices are based on age for the subscription, but $65. So and I got that price. It wasn't just out of thin air. So
For
I've done a
sure.
ton of research. I did a bunch of research on some DPC practices in Pueblo. My prices are a little bit cheaper, but I also whipped out my insurance card, right, through Cigna.
Hmm.
My urgent care copay is $75. Okay. That doesn't include whatever I'm going to have to pay after insurance, right? So I thought, my prices are attractive for people that don't have insurance. My prices are attractive for people that do have insurance because it's still cheaper to pay me. And more times than not, maybe I'm giving discounts anyways to because they're people I know, right? Are like my follow ups, usually they're free. Hey, how are things going? We need tailor something else. Yeah, great. It's free. So and that's the joy of it. And I just enjoy, checking on people, taking care of people. And I
Mhm.
and I feel it's a real pleasure. I'm sure you can relate for people to trust you with their healthcare, right?
Yeah, absolutely, man. When someone trusts you like that, you don't take that for granted, right? Very few people get that kind of respect, and it's easy to lose, right? My view on all of this is I'm willing to lose any amount of money. That's fine. You can always figure that out. But losing even an ounce of trust or respect or reputation, that's huge, right? You cannot
Right.
lose reputation, respect, or trust at any cost.
No, exactly.
Let me ask you this. As far as like the whole DPC model, what kind of struggles do you see as far as scaling and growing the practice as opposed to if you were to take insurance?
I think people are apprehensive. So I live in a heavily medicated, excuse me, have a population that relies heavily on Medicaid and Medicare, and so there are those those resources exist for a reason. And so I think people are apprehensive about that. Like, do you take Medicaid or Medicare? At this point, I don't. But because I kind of offer that concierge, you hit me up anytime you want. We're kind of able to finagle that. So that, to me, that's the biggest obstacle I'm seeing is, do you take insurance? Because we've been so sculpted in our society to be like, that's saving you money, right? You pay
Yep.
$20 copay, but then you go to the hospital for imaging and you're paying $1,500 after
Crazy.
insurance. You're going.
Nuts.
It's there for a reason. Like when Danielle went to the hospital a couple years ago and she was admitted. That was like a $200,000 bill, and insurance brought it down to whatever, 15,000 or whatever. A little bit
Hmm.
more reasonable, but still, it's just educating people that that's um, not always the case. Like, insurance is not the end all be all. And then once people start to do it, they're like, they just don't mind paying the fee to come see me because it's, yeah,
Absolutely. And your fees, dude, your fees are low. Your fees are, and I've told you this before, your fees are low, dude. Like those are some amazing fees. Couple weeks back, I went up to a health and wellness expo in Denver, and there were a lot of DPC practices, probably like 4 or 5 of them. And I talked to each individual vendor, and I'd say the average price for a monthly membership ranges anywhere from like maybe 150 to $300. And it's just like one of those things to where it's like, okay, it's difficult to assess the value when you first start something, right? Because this is
right,
going to grow. One of the benefits of a DPC practice is we're able to take patient input, right? You get patients, for instance, you've had some guys reaching out for hair loss. So guess what? You're doing hair loss now, right? These are
right,
all services. We let the patients tell us they want this. So like, hey, I'd really like if your practice started to do Botox. Well, guess what? We could start working things out to maybe where we could offer that. You're not going to see that at an insurance based practice. They don't care what you think, but we are tailoring a practice to help accommodate patients' needs because that's really what we're here for is patient needs and health, right? We combine it all together.
100%, 100%. And so that is the beauty of, you just allow the patients to kind of dictate, or not dictate, but help guide you. I've thought about Botox, but that's not my passion. And so I'm like, nah, it's not for me. But there are people out there that do it, and they love it. They use it. A lot of the
Mhm.
female providers are out there providing that sale.
Yep, killing it.
Yeah.
Yeah, same dude, same. I just I mean, I don't know if you want that doing Botox on your face, that level of
No.
shake, but the reality the reality is you got to be passionate about it, right? Because there's Botox isn't just Botox. There's good Botox and there's some pretty shitty Botox, right? I've
Right.
seen
Yeah.
both.
Yeah. Like, are you going to take advice? Are you going to take health advice from someone that doesn't use Botox and looks like, has wrinkles? No, I'm not. I have my angry 11s. Like, you're not going to take advice
Yeah,
from me, right? Versus, are you
right.
going to
You
take
walk in, I'm
Botox?
gonna get real fucking nervous.
Yeah. Like
Shit.
someone that's all, you can tell that this is not their first rodeo, that they used it, so just like with you, right? Like,
Right.
you're a yoked guy, dude. I mean, I've seen you transition from just this chunky little bandana wearing.
Testosterone. I still
Like,
do it, dude. I
just
still do it in
show us.
secrecy. In
Yeah, do you?
secrecy.
You wear your bandana?
No, no, dude. Look at those locks, bro.
Yeah, bro. You probably got like
Oh
your
yeah,
hairline
yeah. I'd
probably.
say the hairline's about right here, right where this hat ends. So on the topic of hair loss,
Yeah,
tell me about, that's something I know we've talked about you wanting to expand that service
right,
to help with
right.
the population. What are your thoughts on it? Like what are some of the conclusions you've come to regarding hair loss treatment?
I think, how many discussions did we have at work with other dudes that are they're very
Tons.
anxious, right? They're and how many times did we joke about going to Turkey? A lot, right? We're like, we're going to go to
All the
Turkey.
time. It wasn't a joke. I was
It
dead
wasn't a joke.
serious.
I was looking into it, but men are self-conscious about even women. I've had women come to me about their hair, and so there's so many options out there now. Like on my website, there is literally a page, a PDF dedicated to all the hair loss options because there's so many
Love
out
it.
there. There's not just the minoxidil, there's not just the finasteride, there's other options that you would not even think of for hair loss. And so, like medications used to treat, oh my gosh, I'm having a brain fart. Like Zolotan, what's
It's the
that treat?
autism.
Glaucoma, autism. Yeah,
Oh yeah.
yeah. So
The
medications used to treat,
latanoprost.
yeah,
Latanoprost.
latanoprost. Yeah, yeah. And so
Yeah,
these
yeah.
medications are having some, like even naltrexone. I saw on there naltrexone. Now I didn't do any research on
Oh
naltrexone.
shit.
I don't know if it was for hair loss or if
Damn,
it
dude.
was,
Now Chextone's doing everything.
dude,
People are using
right?
that shit
It
for
was like a
weight loss now,
low,
for motivation.
low dose
Damn.
naltrexone.
Yeah, low dose. Low dose. Yeah, you're not doing a 50 milligram.
There's so many options out there, and then there's combinations of them. So depending on the pharmacy, the compounding pharmacy, you can do different ingredients into to the hair loss. Because I think I've been, just to be personal about it, I've been dabbling in even before I was a provider, interested in hair loss since I was like 18. Genetically, I don't come from the greatest genes, so I've always even done over the counter. So saw palmetto, right? All those I've
Mm-hmm.
dabbled with minoxidil. Right now, I'm doing some topical dutasteride. Again, it was really just trying out the pharmacy and just to kind of see how those
Smart.
do it.
Got
So
to.
using
Yeah.
DP, and I'm actually
BPI
very,
is legit.
dude, very thrilled because I've tried so many topicals where it's greasy, it burned my scalp, and so I was like, I want to try this before I advertise it,
Yep.
and
Smart.
yeah, good, yeah, it's been good.
You used to wake up ready to take on the world. Now, you're just trying to make it through the day. Low energy, brain fog, no drive, weight gain that won't budge. Sound familiar? What you're feeling isn't laziness or age, it's your hormones, and we're here to fix it. At Still City HRT and Weight Loss, we don't sell hormones, we sell second chances to be the person you used to be or have always wanted to be by working as a team and putting you in the driver's seat of treatment. We make it simple: personalized treatment, individualized care, and medications shipped directly to your house. No insurance, no confusion, just results. Everything you need and nothing you don't. Most people feel a difference in 2 to 4 weeks. In 90 days, they don't recognize the person in the mirror. You've spent too long being a background character in your own life. It's time to be the hero of your own story. It's a lot easier when you kind of know what to expect. Like, now when I'm working with a new pharmacy and I'm going to be ordering something new, say it's the hormones, testosterone, some
Yeah,
peptides, I will order one for myself first because I want to inspect the packaging. I want to make sure all the needles are there. I want to make sure everything looks that way. When the patient has issues, I can advise them better, right? I used to make the mistake of just switching pharmacies, switching over to something else, and then realizing afterwards, oh crap, what do you mean they sent you these syringes? Those aren't the right ones. And so, yeah, you have to try it yourself. And I will say, I saw you a couple weeks ago. Your hair does look, it looks fuller. It does.
thank you.
I
That
think it's
means a
working.
lot. That means a lot coming from a bro. That means a lot coming from a bro.
It does. Yeah, yeah. That's one of those compliments, dude. Goes deep.
There's nothing like my wife will tell me you look good today, but when your homie tells you, hey,
It's
your hair looks
yeah.
sick, like they
There's nothing.
genuinely mean it.
Yeah,
My wife
it's
is the
just
word
deeper. It's a
buster.
non-sensual compliment. A non-sensual compliment goes a long
Yeah,
way from dudes. Okay.
yeah, exactly.
FYI to all the bros out there.
Yeah, lift up your bros or tear them down, whatever.
So right now, I mean, just kind of guesstimating. It sounds like you're growing quite a bit.
Yeah.
How many patients roughly would you say you have right now?
Oh, let me. You know what? I don't know. I probably have 30-ish in my
Shit.
system, logged in my system, and so, uh, and it's simple. Like especially people that I know. Hey, they hit me up, Kris XYZ. Give me your date of
Mm-hmm.
birth information. We'll chit chat. Okay, let's try this option. I had a friend yesterday. She's my patient. She hit me up. Hey, do these medications cause these side effects? What do you recommend we do? I mean,
Yeah.
I'm
Yeah,
really.
I love it.
It means a lot when the community members are thinking about me and how I can help them because a lot of them don't want to travel to their doctors. Like I told you, a lot of them are having trouble getting
Absolutely.
to their doctors. A lot of them are having trouble. Even if they get to the doctor, it's a time frame. So yeah,
It's a huge pain in the ass for most people.
yeah,
Like right now, I've been doing some research on what's called psilocybin. Have you ever heard of it?
I haven't, no.
Psilocybin is something that's found in essentially shrooms, magic mushrooms, and it's being used for medicinal purposes now, usually for like mood disorders and stuff like that. But what I have found is a ton of literature regarding the benefits on angiogenesis of the brain, helping to grow neural connections. And I did some deep research on this. Steve Jobs, Elon Musk, Jeff Bezos, these dudes are doing this psilocybin, right? This is a very powerful entrepreneurial style medication. Now, granted, it's a hallucinogenic, so it's going to put you into a trip, right? And so there are medical clinics that are doing this psilocybin therapy. But one of the obstacles is they're all in Denver. And it's a
Uh-huh.
huge pain in the ass because you have to go up, you have to get a medical exam, right? The one I talked to was like an EKG, UA, some blood work. Then you come back, then you go back for your first dose. And it's just like, no one wants to fucking do that.
No.
Ship me the fucking medication, ship me the mushrooms, like let me do it on my own. I mean, it's just one of those things where it's just that's a convenience factor, right? That's a
Right.
huge barrier to being like, okay, I don't want to travel all the way up to Denver like 3 times for this when I can probably hit up some shady dealer on the corner to go get some shrooms.
Right. Yeah, David. He could hit David in his basement.
Oh, I wouldn't want those shrooms.
Nah, dude. I don't even know if he's
Damn,
doing those anymore. We haven't talked about it for
it
a
would just
minute.
automatically just shrink my penis, dude. I don't want that.
And you
I don't
can't
want
afford
those.
that, bro. You can't afford that.
Every inch counts, bro. Every inch
That's what
counts.
I know.
Yeah. So, kind of fill us in. Like, what kind of things do you treat with this practice being a direct primary care practice? Like, what kind of things do you treat? What kind of resources do you have?
So I have right now. I have the ability to do labs. I use Quest. So LabCorp doesn't take um because I'm not brick and mortar. LabCorp won't allow me to use them. At least do LabCorp in and of themselves. So right now I use Quest because I still wanted to offer patients the opportunity to use insurance on that if they wanted, but that's going to be their choice.
Hmm.
And then I can do again X-rays through Pueblo. Oh, excuse me, is it Park West Imaging in Pueblo? I just found those to be the cheapest.
Cool.
Usually, those standalone places are going to be cheaper than using one like a hospital-based imaging center. And
Mm,
then so I can do referrals, and so I've already had a few referrals out, and their referral process has been very seamless. I just get their email or excuse me fax number, write a little note, hey, patient, John Smith needs to be seen for XYZ, and then I have a disposal.
hell yeah.
So my EHR, I have pretty much any pharmacy you want. I have access to prescribe to them, and so I can do it all from the comfort of my phone, pretty much. The EHR I use, you can even almost chart from your phone. It's a basic note. It's not quite an
Hmm.
elaborate note, but I don't have to go very far, or excuse me, it doesn't take a lot for me to do things. But as far as symptoms I treat,
Good.
URIs, sore throats, any chronic care issues, mental health. I've done some contraception. What else have I done? Yeah, pretty much
Do you
anything.
do prostate exams?
If I could figure out a way to do that virtually, I would. I need to create a device. Yeah, I'm actually
Please
working
don't.
on it. What we're going, those ear things that you can use your ear and
Yeah.
put in the phone. Yeah, I want to start actually using that.
There
Um,
you go. Smart
I'm going to
MacGyver it.
borrow my sister-in-law. She keeps sending me pictures of her eardrums to like randomly quiz me. Uh,
There you go.
I was going to say, hey, let me see that real quick, and then go to the restroom.
Yeah, dude. But that's great, man. I mean, so what's the process? Like if someone wanted to get started with you, like they're like, "Hey, I need a provider." What's the process? Like how do they get started?
So you can find me right now on Facebook at Virtual Wellness Solutions. That's my LC. That is my Facebook page. I am working on getting Google optimization to get pushed
Mm,
out to Google. And
good.
then, but also let me. I do not have the phone number memorized. One second. Let me
That's
pull
okay.
it.
We'll put it yeah, we're also gonna have all this stuff in the description of the podcast too. So
Yeah.
we'll have ways to contact you.
Let me get the phone number. So, and this is the HIPAA compliant phone number. The phone number, and this is going to be my wife's number because she's my admin assistant, and just because of my work, she has access to it, and then she knows how to get a hold of me. So the number is going to be 719-674-2476. And then what she does is she reaches out to me. Hey, you have a patient that wants to be seen. When can you do it? And usually, I've seen anytime a patient wants to be seen, they're seen by the end of the day. It may be a little bit later in the day,
Wow.
depending on my schedule. Like last Monday, I had a patient that wanted to be seen after I got off an ER shift. So, we were visiting at 9 o'clock at night. But again, that was just me wanting to provide care for them and not let it linger to the next day. To me, that's very important to like
Hmm.
rest, to make it their issues are being met and that they're being seen.
Hell yeah, dude.
So then what I do is I get their date of birth, email, phone number. I send them an intake link for my EHR. If we're not using insurance, it doesn't need to be very in depth. Some people like to be very in depth about
Hmm.
their information. Some don't, and that's totally fine. Again, insurance isn't telling me that, hey, you don't have a good history on them.
Right.
And we
Cares.
we derive a plan of care. I make sure that all their questions are answered. And of course, one thing you got to educate patients on is ultimately there's limitations to doing virtual medicine, right? I can't touch you. I can't do your vital signs unless they have a way to do the vital signs.
Hmm.
But there's those inherent limitations, and I educate them. You get a shortness of breath, right? Based on their symptoms, they seem stable, but of course, you got to give strict return precautions. Hey, you may need to go to the ER or your primary or an urgent care that if things just don't improve.
Right. Good point. That's a really good point because the reality is the DPC is that bridge between home and the hospital, right? We try to keep you at home as long as possible, keep you healthy. We're preventative, but you have, chest pain with radiation down the left arm and shortness of breath. You don't want to text your DPC practice. You want to call 911. You want to be able to differentiate the two. And it's something that we all see, right? But when people build that trust with you, they're like, I trust you more than the hospital, right? And that's just something that that's where education comes into play, right? When is it appropriate to call us for these concierge type practices versus when is it appropriate to seek life-saving measures?
And there are other online practices out there. I've heard of the ones that are nationwide, right? They cover all 50 states. But I've had one friend who it took her like 40, she saw the provider, it took 24 plus hours to get a visit, and then it took another 3 days to get a prescription.
Yeah, sucks.
That's not what people want.
Mm-mm.
And with me, it's like, hey, you definitely want the patient's input. What antibiotics work for you? What ones don't work for you? Ultimately, we know what medications are best for certain disease processes, but certain patients have certain preferences, or they find that certain medications work a little bit better. I'm not going to provide Bactrim for a runny nose, right? We know that's not going to work, but
Right. Yeah.
it depends on who you
Yeah. So
ask.
I mean, yeah, right. So kind of wrapping this up a little bit, we keep these episodes a little bit shorter. You are taking patients, correct?
Yeah, absolutely, yeah.
Currently taking
So,
patients. Beautiful.
right now, my biggest population is going to be the urgent care patients, especially now, where
Oh
um,
yeah.
I
Coming
I
into it,
think like
bro.
3 weeks ago in the ER, I was starting to see strep throat. Not like all summer, I was seeing strep throat. The definitely seeing more prominent strep, more common viral syndromes.
I bet. I bet. Plus, everyone's going to be inside pretty soon as it starts to cool down.
Yeah.
What is one message that you want to leave the listeners with regarding taking control of your health?
Right now, we live in a beautiful time where we can live life at our fingertips, and your healthcare is no different. Your healthcare is no different. So you don't have to step into a doctor's office if you don't want to. Some people enjoy that one-to-one interaction. I know with my providers, I did, and that's to me why I would go. But if you just need to be treated for something real quick, or you don't want to step outside your home, definitely give Virtual Wellness Solutions LLC um, a try. I do take pride in what I do. Like you said, I think your name is the most important. I don't want to be known for like giving half-ass care. I want to be known for Kris is a person you can trust. To always be the spear of our game, right? You and I have always talked about that.
Tip of the
To be the
spear.
tip of the spear. And the reason that is because being an NP is not as hard as it used to be, right? I mean, there's schools out there that offer this, and so we got to set ourselves apart as to be the best in our field, that patients trust us. And that's what I want to leave with is no matter where I'm at, whether I'm working in the correction setting, the ER, my own primary care, or direct care, I want to leave people with a good experience and a positive experience.